Sometimes I do feel like I'm the mayor of California, not governor. In many ways, it makes sense, right? If we talk about localism being determinative, a state vision is always realized at the local level. And so we're here at a remarkably important and potent local VA that is delivering for veterans, not throughout this region, but also throughout the state of California and all across the country. And so I'm honored to be here, Steve, with you and Mark and Vito. I'm here as well. Very, very proud to be with Senator Padilla and so many men and women that each and every day are not only putting shots in arms, but giving people shots of hope and opportunity and getting people back on their feet, giving people opportunities that otherwise wouldn't be afforded because of the extraordinary work that's being done in VAs all across this country. And so it's right to be here, day before Veterans Day. It's right to be here to celebrate progress and success of the great work that's being done down here to advance our cause of getting more people the immunity that they need and deserve, the immunity that we need and deserve as a community to get through this winter. I've been making this point for now a couple months. Winter is coming. Winter is here. And as we are wont to be reminded, should be reminded, last year we had a challenging winter, particularly down here in Southern California. We started to see around this time last year case rates, positivity rates, hospitalization rates, ICU numbers start to increase. You're starting to see that now all across the globe. We've seen those trends not dissimilar to last year in Europe, trends not dissimilar to last year in countries like Germany. Germany actually had record-breaking cases the other day. We are seeing those trends take shape in the Midwest and the Dakotas. We've seen them in Minnesota. You've seen them in Vermont and New Hampshire. Obviously, headlines have now been driven because of what's going on in Colorado. Less than 10% of their ICU beds now available. And so this, in so many ways, is part of the pattern that is familiar. And the one thing that can interrupt that pattern is the one thing we're here to promote, and that's increasing your immunity that does wane after a number of months, 6 or so months, by getting a booster shot and reminding everybody of the opportunity to get their first shot if they haven't. We met a young man, not a time of life, but a quality of imagination, a youthful veteran who said, I'm here today to get my first shot. He said, it took me a little convincing, but I'm here and I'm happy I'm here. He said, I'm also here to get a little help with housing. And that put a smile to Senator Padilla's face and my face, reminding people that, as Dr. Galley said, the way out of this pandemic is to get people immunized. And so we want to continue to encourage that. At the same time, we want to acknowledge, as Senator Padilla did, the nation-leading vaccination efforts. 55.6 million doses of vaccines have been administered in the state of California. 89.7%, almost 90% of adults in California received at least one dose. Dr. Galley updated you on the efforts that were initiated and launched last Wednesday to get our children 5 to 11 vaccinated. Now north of 100,000 have been vaccinated, but we have roughly 3.5 million children that can afford themselves to that opportunity. 3,100 school sites now have been made available to support that cause. Hundreds of community-based organizations supporting that cause, work being done by not just pediatricians like Mark Galley, Secretary Galley, but pediatricians all across this state to address anxiety and concerns that many parents have around the dosing for their children and around the efficacy and safety of these vaccines. We recognize we have work to continue to do in that space. We're proud, though, nonetheless, by the partnership with the federal government, 1.2 million doses they're committing to for that cause, 5 to 11. Pharmacies will receive roughly 600,000 additional doses. So dosing is not the issue. Vaccines are in abundance. Vaccines are in abundance for boosters. Vaccines are in abundance for our kids. Vaccines, life-saving vaccines, are in abundance for anyone that hasn't yet gotten that first dose. So we want to remind people to avail themselves, remind people that we are starting to see increase in hospitalizations. You saw some headlines today in places like Riverside, San Bernardino. We're seeing case rates starting to rise. We enjoyed the summer. where we had the lowest case rates in America for a large portion of the summer. Just yesterday, we went up to about 16th lowest. That moved rather quickly. I say that not to alarm people, but to caution folks that it was around this time last year that folks started to put down their masks a little bit, started to feel like we can not, spend a little more time together outside of our households and understandably together for the holidays. And we're looking forward to all that. I'm looking forward to all of that and seeing friends and families. Just want to remind people to do it with some common sense and the kind of protections that we're here today to promote. And the most important and potent is getting that booster shot. I got my booster shot a few weeks ago, went off without a hitch. Got the Moderna shot, originally got the J&J shot, which I was proud to do. Didn't have a reaction to either shot. And I want to remind people that it's not only the vaccinations for COVID-19 to get this pandemic behind us, but also flu season. Last year, we didn't have much of a flu season. We're used to flu seasons and flu shots as being part of the prophylactics to address that. This year, just want to remind people that we want to avoid the twindemic that is referred to by some and get that flu shot. I got my flu shot about a week prior to getting that booster shot. Some people I was just talking to got the flu shot the same day that they got booster shot. And so I want to remind people to get those flu shots and get the booster shots. I'll also just, in closing, remind you, and I will highlight one other reason we're here at the end, but I'll remind you, you can go to My Turn. We have a webpage, My Turn, which will, has frequently asked questions, also has apps, so you can schedule myturn.ca.gov, or just Google My Turn, Yahoo My Turn, Bing My Turn, and make some determinations around proximity and access to booster locations. And I just want to note that the overwhelming majority of people that are getting their boosters are getting them at pharmacies. In fact, just shy of 60% of people last week got their vaccines from pharmacies. We had about 726,000 booster doses in the last 7 days, last week in the state, and a little shy of 1.1 million people getting shots, 131,000 yesterday. So we're starting to see those numbers go back up, over 1 million a week. But again, boosters being the majority at the moment, and again, pharmacies being the most convenient, seemingly most convenient way to get a boosters for many people. But local health officers, local health organizations, and your plans, across the spectrum, more locations, more choice. You have more voice in terms of those options and opportunities all throughout the state of California. So let's maintain that vigilance. Let's keep our eye on the ball. Let's recognize that there is a pattern, there is a seasonality to COVID-19. While we were spared the worst in this summer, the prospects of a challenging winter are upon us, and that's why we're doing everything in our power to prepare and to protect ourselves. And so that's a fundamental cause that unites us here today. But there's another cause, and I appreciate the reference a moment ago by Vito and others that is important. It's a cause that really defines so much of the stress and anger, frustration people understandably have about not only their state, but our nation, but particularly here in our state. That's the state of the homeless issue. And many people over the course of the last few years have sat there bewildered at why there was a large encampment of tents of veterans, Americans' heroes, out there living on the sidewalk right here, right outside this facility. That's no longer the case. And I want to applaud Secretary of the VA. I want to thank the Biden administration. They quite literally picked up the call, not the baton. The baton was dropped in the last administration. They picked up the call and made this a priority. They worked with local agencies. They worked with nonprofits. They worked with LA County. They worked with local officials. They did the right thing. They gave dignity and respect to our veterans. They deserved, got them on the inside of these gates. Many of them gotten housing, permanent housing, many getting support, behavioral health support, physical health support, but many are still struggling. And that's why I'm very proud of the work VA here has done to meet people where they are, to bring those tents on the inside, to create a pathway out of those tents, at a pace that meets people's needs, to cohort our veterans in a way where they feel protected and respected, and today to announce that because of a contribution from 5 Point and Lennar, Jeff, thank you for your leadership. Thank you for picking up the call and the mantle of responsibility. We're all in this together. Thank you to Lennar. They will be providing 86 tiny homes to our veterans on this site. Lennar didn't have to do that. They chose to do the right thing. They chose to be part of the solution. They could have pointed fingers. They could have talked about the way the world should be. Instead, they're doing something to help our seniors, give them dignity, not just a tent, but a key, a lock. It's a tiny home, but an opportunity to continue that transition. And I want to thank them for that, as well as the Hilton Foundation that provided money for wraparound services, supports to help the extraordinary staff here, and others provide mental health and other important supports to address the underlying reason so many people out in the streets and sidewalks in the first place. Listen, I've said this many times. I won't burden you with what we did in this recent budget, but $22 billion reasons. There's never been a number as big and bold and a strategy as comprehensive to address the issue of housing and homelessness in our state's history, I'd argue our nation's history, at a subnational level. $22 billion is being invested in the issue of affordability, housing, and homelessness to support these efforts all throughout the state of California. Yes, I see what you see. Yes, I'm mindful of what is happening, but I'm also more optimistic than I've ever been. You are seeing progress. I am seeing progress. We are witness to progress. There's a different intentionality, different support here, a different collaborative spirit with our federal government, with incredible work, Senator Padilla and his office aiding and guiding us with federal agencies, and of course, the support that has been persistent and consistent here at the local level, advancing this cause together. I'll close, and forgive me, I'm extending with a long-winded point of personal privilege, as it were. Tomorrow I'll be celebrating, and Vito, you reminded me of this because I referenced it a little bit last year, Veterans Day, a little bit about my grandfather, who was a prisoner of war, Arthur Menzies. He spent years and years as a prisoner of war, marched in Corregidor, fought side by side in Philippines in World War II to defend our freedoms and our democracy. And his story, and I won't belabor it, is a story that can be told over and over again. While he didn't suffer the physical wounds of war, it was the invisible wounds of war that took his life. He took his own life after returning back from that experience overseas. And it's a reminder to all of us that it's often not what we see that is the real issue. It's what lies underneath. And let us be sensitive to those struggles, seen and unseen. And let us meet people where they are, and let us provide the kind of respect in substance that we do rhetorically when men and women are in uniform, when they come back and no longer wear that uniform, but often wear those wounds associated with their service. And so I'm very proud of this VA, Steve, your work, and the work of so many others that made possible that opportunity to make a small but demonstrable impact on the lives of many men and women that sacrificed so much for each and every one of us. So that's what brings us here today. We're grateful for the incredible leadership assembled, and we're happy to be here with all of you.